Okay, welcome everybody. My name is Dr. Radhakrishna. I have been training doctors worldwide. I've been training doctors in India, in Italy, in Taiwan, in Indonesia, in Malaysia, and nutritionists and naturopaths in New Zealand. And subsequently, um, over the 9 years, I've trained several thousands of doctors. So I train doctors into looking at S-drive and reversing diseases. So in the vitamin sections, we have 16 vitamins. So one of the most important questions that people will ask you when you show an S-drive, doctor, what is the function of S-drive? Vitamins in the S-drive. So you and I should be able to tell a few usefulness of vitamins. Okay, usefulness of vitamins. Okay, just two or three. Don't need to know everything. Why it's important for you. So basically, it's for bones, it's for thyroids, it's for energy. Just a few things that you need to know. Okay. So now we go. There are 16 vitamins. Can you see boron? So in the 16 vitamins, I'm only going to focus on two or three vitamins, nothing more. Okay. Um, so that we can focus on um, S-drive. Not there. I don't understand what you posted. Okay. In the boron, I think this is the old version. Boron means bone. Okay, boron means bone. So boron is used for bone density and also building muscles. Okay, building muscles. Um, okay, hold on. He said screen not shared. Sorry. Um, thank you. Okay. So if you see. There are 16 vitamins, 16 minerals. In the 16 minerals, you can see you need to have a few understanding what minerals can do for the body. You can see boron. Boron highlighted, it shows boron. Boron means bone, so easy for you to remember. So what's the function of boron? For skeletal muscle density, for body muscle mass index, and it's also part of the bodybuilding product and because it increases the production of testosterone, prevents body aches, and for building muscles. And boron is directly or indirectly related to parathyroid, which I'll explain to you as we come to thyroid functions. So the next one, I will focus on two or three important elements here, not everything. Calcium. Okay, calcium. So what does calcium do? Calcium is, hold on. Okay, calcium. So the function of calcium is for bone, cardiac muscles, colon cancer, healthy gums. But what I want to explain when you see calcium, okay, when you see calcium in your blood test, let's say you're seeing in a blood test, calcium, normal, they give you the normal report, is different from the calcium that you see here. Okay, so everything I want to simplify into five steps. Okay, you can take note. I'm writing it out so that you'll get the notes. Calcium indication: one, bone; two is a neurotransmitter; three, okay, calcium also it means that you have lead toxicity. Four, calcium calcium also, it can mean that you are depositing your calcium in the wrong places, like coronary. But you need to have other indicators like K2 deficiency. So you cannot take calcium per se, but basically these three more indicators is important. So you can see some of them, neurotransmitters, they may be irritable, they may not be able to sleep well, and so many other factors. Okay, so you can please go back and read more about it, where calcium is involved. Okay, and it's a very simple, straightforward stuff. Okay, let me go back to sharing the slides. Calcium. Okay. Next. Next one will be, yeah, calcium may be also related to colon cancer. Single indicator is not good enough. Okay. So if you see calcium, most of the calcium is absorbed in the intestine, but most of it is excreted in the intestine. And if you look very carefully, the bone will be remodeling many times. And ultimately, it's excreted to the kidney. So when we are seeing a blood test, what does it tell you? What does it tell you when you see blood test? It doesn't tell you anything. It's just that we are imagining calcium is low. So you and I have to ask him, is it from a bone origin, or is it from the kidney origin, or is it it's affecting the heart, or is it affecting the brain? So as an intelligent doctors, all of us, we need to diagnose like that. But in a blood test, it does not show these kind of results. Why? Is because one damaged kidney can compensate the other kidney. So it's impossible to have this kind of understanding because you need many correlationship. Okay, so the other fifth point of calcium is it's for cardiac, okay, cardiac transmission. Okay, so if you can go back, if you go back and read, we can see it's related to phosphorus, okay, and so many other factors. So next time when you look, the blood test will never be the same. Okay, so if you look at sometimes when you look at the fingers, you see white marks. It could be a calcium deficiency. So you don't need to have extensive. We do clinical investigations. Okay, the next one is chromium. Let me go off the chromium and explain to you. It's easier for me and for you. Please draw this diagram on a paper. Take a piece of paper. Okay. The more you draw, the more you become better. Okay. Can you see? Okay. So in front of the patient, when you see chromium, you tell them it's a pre-diabetic. Why pre-diabetic? Draw like this. Okay. So now you have person is taking food down there. Food. Okay. So food is converted to glucose. So comes food here, and you have glucose, glucose, glucose. Okay. Once glucose is released, it is absorbed in the intestines. So you have glucose, 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 glucose. And this is the blood vessels. Please draw this diagram on a paper. Okay, so this is 1, this is 2, this is 3. You draw the numbers. So once glucose is released, pancreas releases insulin. For insulin to come out from the pancreas, you need a carrier. That carrier is required zinc. Okay, so once zinc helps the insulin to come out from pancreatic beta cells, this glucose will get deposited in the liver. So glucose is converted to glycogen. Excessive glycogen is converted to fats. So now you draw, this is number 4, this is number 5. So the importance here will be the muscle. So in the muscle, you have an insulin receptor. Okay. So now glucose, once it's released, is insulin will stimulate the insulin receptor to have the signaling pathway until it releases a glucose 4 transportase. So once glucose 4 transportase is released, it opens up a window in the muscle for glucose to come in. So this is 4, this is 5, sorry, this one will become 6, this is 7, this is 8. The glucose coming in is number 8. So once there is too much of glucose inside and outside, this shuts down. Okay, this is called insulin resistance. So in our normal regular workout, when we see HSCRP inflammation in diabetics, then we do IGF-1. Okay, then we do maybe testosterone levels, indirect indication. Then we may do serum insulin or in India they do the peptides. Okay, all this will only tell you what the sugar level is. It does not tell you the insulin resistant component. So if you see zinc deficiency, that is insulin resistance. So what can aggravate the insulin resistance is number 1 will be toxic metals can block this signaling pathway. Number 2, chemicals. Number 3, LDL. Number 4, oxidative stress. So to open up these, you require chromium. So when you see zinc or chromium deficiency, is a pre-diabetic. So most of the times I have seen patients coming with metformin or second drug, third drug, without understanding that when I see the S drive, it will show chromium deficiency. It may show zinc deficiency. It can show toxic metals. So once we remove these, correct this, you reverse diabetes. So over the period, you can remove the metformin, the insulin injections, and everything else. If you don't do that, what happens is that there's a progressive deterioration of his diabetes. So generally, if you ask me, if I look at one patient with metformin or maybe 2 drug, in my belief, that patient may not be a diabetic in the first place. So what do we do? Okay, you have to ask very important questions, like whether the patient has got vaccines, patient had COVID, whether he has amalgam, what's his occupation, whether he's staying in an industrial area. By sheer asking a question, we'll be able to tell that this is insulin resistance. Then in India, okay, in India, so they use a lot. I mean, each place depends on the ground level water. Okay, some places I found radiation very high. In certain places like Delhi, the pollution is extremely high. In Punjab, pesticides may be very high. In Malaysia, like Kuala Lumpur, maybe a little bit air polluted. Okay, but the groundwater counts a lot. What we eat, what food we grow in. So if you can remove the toxic metal chemicals, LDL and oxidative stress, and replace with chromium and zinc, you reverse diabetes. But what we do HOMA IR to see how much of insulin resistance measuring. What are you measuring? What are you, fasting blood sugar is not an indicator to reverse. So we'll take one drug to another drug to a third drug to a fourth drug. And I find it amazing. We all are very intelligent doctors. So somewhere along the line, we are unable to add um, our intelligence to what we see because we are so pharma driven. I find it difficult to understand why did we learn biochemistry, physiology, and all these, and then ultimately we don't apply. So it took me a long time to connect it. So when you see these kind of stuff, okay, for example, a patient coming with two medications of anti-diabetic drugs, and then he's also on insulin. So I always wonder, okay, somebody pass on the message. Yeah, screen not shared. I'm not sharing the screen yet, okay? Um, okay, I'm explaining to you that what I see, okay? So I'm actually going to show you this part. How does it affects our diabetes and insulin, okay? So I break it down further. So this diagram, you draw it on a paper and please give it to the patient. So when the patient goes back, they understand why the chromium is less. Because my RK diabetes has all these components. Okay, it has got zinc, it has got chromium. Okay, so if you look at that pathway that was blocking, it is like glucose converts to glucose 6-phosphate to fructose 6-phosphate to glyceraldehyde 3-phosphate to 1,3-diphosphoglycerate. This goes into what you call a polyol pathway. And these will communicate back to this. So here, our fasting blood sugar will be normal. But the patient is on 2 diabetic drugs and on insulin. Why? Because extracellular insulin, extracellular glucose is normal, extracellular. But the internal cellular is very high. That is why it will progress to Ages pathway. This is a PKC pathway, and this is Ages pathway. So what you're seeing at the insulin resistance is this Ages pathway. So you can see the patient is progressively becoming bad. What is causing this Ages pathway is what most doctors miss it. So when you correct all these factors, you reverse insulin. On top, when you see S-drive, you must correlate. Okay, you're seeing chromium deficiency, you're seeing calcium deficiency, you're seeing toxic metal deficiency, you're seeing D3 deficiency. All these are insulin resistant factors. There are 20 insulin resistant factors. That is why for reversing diabetes is totally a different methodology of training. Okay, so we go back to S-drive. So we finished uh, calcium. Okay, chromium we finish, copper. Okay, so it also means that you have high levels of cholesterol. You need to regulate, the blood pressure need to be regulated. Okay, so can you see the insulin and the receptor is chromium, so it sticks down there. Okay, so it allows this thing. The next one is copper. Copper is around 200 reactions, 200 cofactors in the body. So please read up about copper. Okay, copper, and I'm not going to be very specific about it. Please read up. Okay, can you see iodine? So what does iodine deficiency means? Okay, for doctors in the clinic, I suggest you to buy. Um, I suggest you to buy Lugol's iodine. Put it on the wrist, especially if you're fair. 30 minutes later, if it's lighter in the coloration, that means patient's hypothyroid. Okay, hypothyroid. Okay, very, very important. There is one. Iodine is a protein, is a carrier. Okay, so I will actually show you the video of how to look at thyroid in a total different manner, okay, in a later while. Okay, iodine. Iodine also means that you are uh, iodine also means that you are hypothyroid. Hypothyroid means you are uh, Hashimoto's. Hashimoto's means you are basically autoimmune condition. Okay, I'll come back. So you can ask them to take iodinized salt. Okay, you can get it in the pharmacy, not in the supermarkets. Okay, you all can go back and read. I'll go into thyroid in detail afterwards. Okay. Okay, so please read up. Every one of you are an expert in this iodine. And the half-life of T3 is 1 day. Half-life of T4 is 7 days. Okay. Okay, so if you're going to do a blood test when you see thyroid, iodine especially, plus please do TSH, T3, T4, and thyroid antibodies. Most of the labs do not do thyroid antibodies. Most of them try to make it very cheap test. So they only do T3, T4, some of the labs will do T3, T4 and TSH, but not thyroid antibodies. Plus you also look for chemicals may be blocking, toxic metals may be blocking, gluten can be another person will be blocking it. Okay, management will be look for the root cause, not correcting thyroid first. Look for the root cause, remove the root cause. The damage done by the root cause is where these things occurs. Okay, you need to detox. Okay, management. I'll come back to this advanced knowledge, Himalaya salt and everything else, probiotics and AC. Okay, what's the next subject? Iron. Iron is, of course, it's a hemoglobin carrier, oxygen carrier. It also means that you have a stress, not necessarily intestinal stress. It can be a mitochondrial stress. So I want to explain to you when I see iron, this is what I see. This is mitochondria. One, two, three, four, five. So this is where CoQ10 comes in. This is where iron plays a very important role because the molecules must jump from one place to a next, to the next, to next until it forms ATP. So iron plays a very important role in mitochondria. Okay, NEG. So most of them are giving iron, IV iron without understanding it plays a very important role in the mitochondrial dysfunction. It also is the intestinal stress. Okay, it's part of the distress. Okay, let's go back to the minerals. Sorry, I got too many slides open up there because I'm studying. Okay. Okay, so sometimes we fail to watch at the tongue. It can be a microcytic anemia. I made a mistake in the first part. When you have B12 deficiency, it's megaloblastic. It's not microcytic. Okay. Oh, the next one will be lithium. If you find lithium, it also means, lithium is used for mental diseases. But they found that if you're using into Drosophila insect, they have done a study on Drosophila. Okay, so Dr. Edwin has posted chronic inflammation, infection with normal ferritin. Dr. Edwin is my Sifu, and he's very well read. Okay, please do not take a challenge on him. He's very well read. Okay, and from him is where the whole learning process has come from me. Okay, we stimulate and then we take on from there. Okay, Drosophila insects, they found that if you have a little lithium, it extends life. So it's not necessarily only for mental disease, it's also meant for extending your life. It also meant for neurotransmitter. It is also part of thyroid. So thyroid indicators, one will be iodine deficiencies, the second will be thyroid lithium deficiency. I'll go through. Okay, the next one will be magnesium. Okay, magnesium. Magnesium. So can you see magnesium? Okay. What I'm going to do is I'm going to put a pause to the recording. Okay, sorry, because this is. So magnesium requires boron for a better absorption, or it also works along with the parathyroid hormones. Okay, and please go back and read about magnesium in your books or on Google. Do research and find out the normal mechanism. How does it affect? So there are many types of magnesium: magnesium oxide, magnesium citrate, magnesium orotate, chloride, lactate, sulfate, carbonate. So at several places, some things are more important. Like for example, the brain. The brain requires magnesium orotate. Okay, for a better blood-brain ability to core. For the intestines, it may be different. Okay, so the daily requirement is between 500 to 1,000 milligrams, and it's good enough to reduce blood pressure. Okay, next we come to lithium. We know manganese. Manganese is again bone. It is also part of mitochondria. It is also part of osteoporosis. It is also part of fatigue. Read up about it, please. Okay, you can see molybdenum. Molybdenum, if you see, it has got four factors. It is a sulfide oxidase, xanthine oxidase, aldehyde oxidase, mitochondrial amidron reducing component. Basically, when you see molybdenum, it's basically a detox. I've seen one FDA approved drug. They're using molybdenum to reduce uric acid, because xanthine oxidase is part of uric acid formation. So if you are testing on a patient who has got high amount of what you call uric acid, it could be deficiency of molybdenum. Okay, it took me 1 year to really find the functions and read up about it. Okay, and it's also required for sulfur containing amino acids. Potassium. Okay, you can read up about potassium, please. It's a mineralocorticoid. Basically, potassium means there's an adrenal stress. Okay, you can read up about these, please. We don't have to waste time. The next one will be potassium, low potassium. So you need to know how to replace. Okay. The next one will be sodium. Sodium, if you find, please read up. Sodium potassium deficiency is basically adrenal stress. Read up about renal impairment. Okay. Selenium. Okay, so selenium. We come to selenium, right? We miss selenium. Okay, selenium. Okay, selenium. Can we go to off the light recording? So what's the next chapter we're going to do is please go back and read the subject on Google or in PubMed, American Journal of Heart Medicine, on all the details. Silicon is another problem with bone. Okay, silicon is the most abundant material on earth, but when you see silicon, it means you have a bone osteoporosis early, or it can also means that you have a aluminum toxicity. Okay, as far as I'm concerned in S-drive. Okay, silicon, aluminum, and can be associated with alopecia. Okay, Aluminum. Aluminum can last in the body for more than 100 years. Okay, advanced knowledge. Okay, leave all that. Then we go down to sulfur. Sulfur is also part of bone. Okay, so I want to draw a diagram what sulfur is all about. Sulfur is sold in the pharmacy as a beauty product we call MSM, methyl sulfonyl something methanate. Okay, you can read out. But how do I see sulfur in S-Drive and how do I interpret it? Okay, this is how it looks. Methionine converts to homocysteine, homocysteine to cystathionine, cystathionine to cysteine, cysteine. So in the cysteine to glutamine. Okay, can you see? Okay, glutamine. Sulfur comes from here. Sulfur also comes from here. Here you get taurine, you get cysteine, and you get sulfur. So when you have sulfur deficiency, that means there is a relationship with methionine and cysteine. Okay, that is why in RK Restore you have both cysteine and glutamine. I don't give glutamine alone. The reason is you miss these three components. So it's balanced between these and these. But if you have to give glutamine, you have to give 500 milligrams. 500 milligrams is equals to one capsule. It is so much. So I have to balance between these two so that it has a synergistic effect. So what is glutathione? Glutathione is an addition of one more molecule called glycine. Okay, so if you see sulfur, it means either you have skin allergies or it can be a bone problem. That this is a part of the cycle that what I see in sulfur. Okay, so let's go to sharing the last part of the details. Okay. Okay, zinc. I actually wrote about zinc before. I'll come back to zinc again. Zinc means, again, 5 things. 5 zinc. 1, it is required for T4 to convert to T3, zinc. Zinc is also required for intestinal villus. Zinc also means that uh, is required for hair. Okay, zinc is also part of immunity. Zinc is also meaning that you're having cadmium toxicity. I hope I'm right. Okay, so S-Strife, if you see toxic metal and zinc deficiency, that means you have cadmium toxicity. That means somebody is a smoker. Okay, so that's how the 5 things you have to remember. When you see zinc, zinc is not zinc alone. Okay, it means also meant for sperm, for healthy sperm. Okay, so if you go down to look at some of this, they have combination in pharmacies. Sometimes you don't want to touch because somebody who developed it never understood biochemistry or the relationship. Okay, you got to be careful. Okay, so now we finish on minerals. Let me go to thyroid for more details. And I want to go on thyroid, yes. Okay, let me share first. Okay, thyroid is a very big topic from an S-Drive point of view. We look at you can read up about this: high thyroid, free thyroxine, high TSH, low TSH, what is hypothyroid, what is hypothyroid. So thyroid requires all these nutritional ingredients for a better function of thyroid. Not only thyroxine, you also need all these, okay? So there are almost like 15 things related here. Uh, okay, If you look very carefully at this diagram, okay, you can screen capture this, or I'll post it in the group. Thyroid requires 6 elements, 6 factors that's required for this. Number one, factors that inhibit proper right side on the right top part, the production of thyroid hormone. That means it can be stress related. Okay, it can be infection. There can be infection that's affecting the thyroid, trauma, radiation, medication, fluoride, toxic metals like pesticides, mercury, cadmium, lead. All these toxic metals will be blocking the thyroid. Okay, then you can also find factors that increase the conversion for T4 to T3. That is why when you see S5 test, you see a selenium and zinc deficiency along with your TSH, T3, T4. That means basically this person is hypothyroid or Hashimoto's. So if you see on the lower part, factors that improve cellular sensitivity of thyroid is vitamin A, exercise, zinc. So a lot of us don't exercise. The older you get, the less exercise you do. No problem. You can at least do some walking, because one of the major important factors of patients or we as doctors becoming slower in life is because of thyroid. So thyroid is a very important factor. So on the left side, on the top part, you see the contributing factors of a proper production of thyroid hormones. So it's iron, iodine, tyrosine, zinc, selenium, vitamin E, B2, B3, B6, CD. And then if you look at the other factors that increase the conversion of T3 to reverse 3T3, stress, trauma. These are the factors we don't address, and these are the factors that we don't do blood tests about. So it's very important for you and me to understand if there's inflammation, at least HSCRP, if you look at a TSH-T3 low or high, and then you see HSCRP, most likely there's an inflammation going on. And then retrospectively, we have to look at why is that inflammation going on? What is causing the inflammation? So inflammation is a very huge topic we'll do on another time. Okay, that's one. So what is the relationship of thyroid and iodine? Okay, so you can read up about this. I'm just giving you some of the clues to here. Okay, you can read up, please. Factors that inhibit conversion. So you can see cigarettes, goitrogenic food, medicine, okay, iodine, low progesterone is a. So if you and I are going to learn on a subject called hormone, bioidentical hormones, and you're not done S5, some of these factors are missing. You're not wrong, you're right, but it will help us improve the thyroid function by addressing these factors. Okay, and you can see TSH production requires protein, magnesium, and zinc. T4 reduction production requires vitamin C, B2, and iodine. T3 requires selenium and healthy liver and adrenal. So 20% is of thyroid from T4 to T3 is converted in the liver, 40% in the gut. That is the reason that we need to clear the gut for a better production of thyroid and detox the liver for better production of the thyroid hormones. Then you balance out the hormone balancing. I tell you what, the patient will look like as though they develop miracles. Okay. So if you look at the pathway, if you look at it, the TPO, can you see 90%? Okay. When I was in India, they asked me this question. I asked them very simple, doctor, how much of T4 is produced in a day in the thyroid gland? How much of T4 is produced in the converted in the gut? How much is converted in the liver? They could not answer. How much of T3 is converted in the liver? How much is converted in the gut? They could not answer. That is why we have to use our intelligence and learn again and again until we become better. Okay, so these functions of iodine, any of us can do. Okay, half-life 1 day and 7 days. Okay, just leave that. So what to do? We have to do TSH-T3 and thyroid antibodies. We also have to look for chemicals, toxic metals, radiation, and gluten. Gluten and thyroid are having similar antigenicity. So many times when I look at the S5, it will show you gluten and iodine deficiency, gluten or selenium deficiency, gluten and zinc deficiency, and the patient's thyroid hormones are very less, and the TPO is very high. We need to also test for D3. Okay, so management, you need to correct the zinc and the selenium, iodinized salt, and you can probably detox the liver and the detox the gut, and you please use a bioidentical hormone I tell you what, you have done a fantastic job. Okay, so advanced knowledge. Okay, so you can see selenium deficiency, potassium deficiency, lithium deficiency, iodine is all related to thyroid. Okay, tyrosine. So tyrosine, what is tyrosine? Phenylalanine converts to thyroxine. Thyroxine converts to tyrosine converts to thyroxine, adrenaline, dopa, and melanin. So sometimes when you do an S trial, you see phenylalanine deficiency, or it directly shows you tyrosine deficiency. Tyrosine is part of BH4 cycle, tetrahydrofolate cycle. Okay, so I can read all these cycles very fast, but just for help you understand, if you are not using S trial, don't worry. Okay, and read up about this thyroxine function. So if you look at the pathways, you see, when we are seeing the patient, we are not looking at the pathways, but we must have an educated understanding that these are extra things required. Maybe when you are giving a thyroxine, probably you can add on selenium on top of it. Okay, clear out the gut, clear out the liver, okay, detox the liver. So as a patient sitting in the front, don't just look at the blood test and say, oh, you have got this very high, let's put in radioactive iodine, let's give you thyroxine. No, that's not intelligence. That's not intelligence at all. An intelligent doctor will look at the pathways and correct the pathways. So I learned to correct metabolic pathways. Okay, and you can have the food. Can you see tryptophan? Sorry, tyrosine deficiency. I can tell you straight, patient is hypothyroid. Hypothyroid basically is Hashimoto's. Hashimoto's is equals to autoimmune diseases. Okay, selenium. We have read this extensively about selenium T4 to T3. Can you see? You have selenium deficiency, iodine deficiency. This patient is hypothyroid. You do blood test, I do S-Drive. The difference, I'm ahead of the blood test. Okay, zinc and thyroid, same thing. Okay, same thing. Okay, next, zinc. Can you see zinc and selenium same time? Hypothyroid. Okay, calcium means basically this patient is having lead toxicity. So the lead toxicity is blocking the thyroid hormones. So no matter how much of hormones you give, they will feel good at the moment. The moment you stop the hormones, the patient will become hypothyroid or may have other diseases associated. Okay, T3. T3 is immunomodulator. Okay, I want to play this video 5 minutes, and this is where you learn how to catch thyroid diseases ahead of blood tests. Because S-Drive, thyroid Hashimoto's goes to 5 stages. Stage 1 is genetic predisposition. Stage 2 will be cell infiltration. Stage 3 will be, that's when you find a TSH or T3 changes, and we say wait and see. Stage 4 will be where you see definite T3, T4 changes. Stage 5, full blown. But what S-Drive do is we catch at stage 2. At stage 2, you may find selenium deficiency, zinc deficiency, iodine deficiency, tyrosine deficiency. The presenting features of stage 2 will be depression, anxiety, palpitation, health-seeking behavior. They'll come to you, and then we miss the diagnosis because we are so caught up with the blood test. So I'm going to play this very important video for you, and you can really understand. Can you play the sound system also? I'm going to play this. But this. Huh? It's playing for them, whether they hear it or not. Okay. Dr. Kalpana, can you hear the video just now?
No, Doc. Can't.
No. Yeah. No, there's a video audio sharing somewhere. Play. Okay, play.
So
Yeah, messaging.
Let it be.
one important thing to note with Hashimoto's is...
Okay, Dr. Kalpana, can you hear? Dr.
Yes.
Kalpana
Yes.
can, huh?
Yes.
Okay, good.
You can turn.
So where's the mouse? Okay.
Clients with anxiety actually have thyroid antibodies. So one important thing to note with Hashimoto's is that it's not like black and white. It's not like you just have it full blown or you don't have it. There's actually 5 stages to Hashimoto's. In the first stage, for all intents and purposes, your thyroid function is normal, your immune system function is normal, and you're not going to have any symptoms, right? This is just the genetic predisposition. The second stage is when things start to change. So we start seeing an infiltration of white blood cells right into the thyroid gland. And people can start seeing changes in thyroid antibodies. So you might see thyroglobulin antibodies or thyroid peroxidase antibodies in this stage, but the TSH will still be normal. The other interesting thing is there's also seronegative Hashimoto's. So some people don't even have thyroid antibodies, and doing a thyroid ultrasound or a biopsy might be another way to find thyroid disease. But really, unless you biopsy every single cell within the thyroid gland, you can't tell if there's white blood cells in there. So it's really not something you can necessarily exclude by doing thyroid antibody tests. The other thing is, in this stage, there's just beginning attack of the thyroid gland, so the thyroid tissue may still be intact, but the body's already compensating. And this is when we start seeing symptoms. So people in this stage are going to have the panic attacks. There's multiple studies on the different types of symptoms that are correlated in this stage: obsessive compulsive disorder, panic attacks, anxiety. One of my favorite one was health-seeking behavior, hypochondria, right? And a lot of times, traveling the country the last year or so, I've interviewed over 60 patients with thyroid disease. And through my platform, The Thyroid Pharmacist, I have over 300,000 people that follow me online, my clients and whatnot, and they all share the same stories with me. Is like they were going to get care. They were trying to seek the help, but people were just telling them that there was, you're crazy. Here's an antidepressant. You're just fat. You have fork and mouth disease. You need to eat less. These are true stories, right? And then that's stage 2. Now, if you can get a person diagnosed in this stage, you can prevent a lifetime of fork to mouth disease. You can prevent a lifetime of depression. And you can also prevent the need for thyroid hormones or thyroid medications, because you can, while we have some technologies that can reverse and accelerate tissue healing, it's much easier to prevent damage on a thyroid gland than it is to regrow new tissue. Stage 3 is when more progressive doctors are starting to diagnose people where a person will have subclinical hypothyroidism, and they will also have slightly elevated TSH, and then they will have, the thyroid antibodies or not. And at this point, we start seeing more and more symptoms. We know that treating people with thyroid hormones at this stage can also be helpful. For pregnant women, this is usually a must, but in the conventional world, whenever a woman who's not pregnant comes in with a TSH, 6, 7, or 8, she's told to wait and watch. To wait and watch for what, right? For it to get worse. And so stage 4 is overt hypothyroidism. This is when most people get diagnosed, right? And at this point, they are prescribed a medication. I think we all know the brand name levothyroxine. It was the #1 prescribed drug in 2 out of the last 3 years. It finally got beat out by Vicodin last year, right? And this is something that they're getting. But many of them continue to have symptoms with this medication, and they're told, oh, well, your thyroid's got nothing to do with your hair loss. Your thyroid's got nothing to do with your weight gain. And your thyroid has nothing to do with your depression. And the scariest part is that this medication is not only, it doesn't really help the symptoms that it's supposed to treat, but it also doesn't stop the progression of the condition. So we know that Hashimoto's, like every autoimmune condition, is progressive. And so stage 5 is when we start seeing progression to other types of autoimmune conditions. I've talked to so many people around the world who were good girls. They took their thyroid medications. They did everything their doctors said. And then they were diagnosed with rheumatoid arthritis or lupus or another type of autoimmune condition because the root cause, the trigger, was still there. Nobody was doing anything about it. And so just a quick summary. So people have thyroids, people have symptoms. And a lot of times they're misdiagnosed with mental health issues when they have thyroid antibodies. And this is going to be as, you might not see any changes on the TSH. You might just see these changes when you do thyroid antibody tests. And so these are some of the antibodies to do for thyroid peroxidase, thyroid globulin, TSI, and TSH receptor antibodies. But so clients with anxiety actually have thyroid antibodies. The root cause, the trigger, was still there. Nobody was doing anything about it. And so just a quick summary. So people have thyroids, people have symptoms. And a lot of times they're misdiagnosed with mental health issues when they have thyroid antibodies. And this is going to be as, you might not see any changes on the TSH. You might just see these changes when you do thyroid antibody tests. And so these are some of the antibodies to do for thyroid peroxidase, thyroid globulin, TSI, and TSH receptor antibodies. But so clients with anxiety.
Okay, so I want to stop sharing here. Okay, I hope you understood how thyroid progresses. That is the reason when somebody comes with a normal thyroid test and still shows history of anxiety, depression, or health-seeking behavior, or many other behaviors related to a mental health, it could be thyroid. So please believe me that the test you're doing is not doesn't correspond to functional medicine. Functional medicine you see ahead of time. So S-Strive will give you an idea to look beyond the blood test, ahead of the blood test. So S-Strive is one step beyond. And the other factor that I want to explain to you, if we do not treat stage 4 properly, stage 5 of Hashimoto's, it may end up with arthritis, especially like SLE. It progressed to newer diseases. So I strongly suggest you to go back and read. I posted 2 more chapters in the in our S-Drive group for next week Friday discussion. The 2 chapters is for Dr. Selvam. Dr. Selvam is a physician and is a diabetologist. So I posted a related subject because next week we're going to discuss on amino acids. And I also posted again selenium and cancer relationship for Dr. Unati to present next week. So I'm hoping to discuss more details on selenium, why it's very important for women. And I'll exactly draw for you a picture of how I see cancer ahead of time. Okay, and let's go to the continuation of thyroids. Okay, this is one of the tests we have done on a patient with Dr. Azlina. So she sent me a test to show the TSH is around 10, which is very high. T3 is around 3, it's just moderate, lower part of the normal. T4 is around 14, which is normal. Serum insulin levels normal. But if you look at thyroid antibodies and thyroid peroxidase, I have never seen these kind of tests ever. And this patient had severe psoriasis. So when we did a regular test, this is what basically we saw. Okay. So when we're discussing about selenium next time, I'll give you more insights of how we beat this thyroid autoimmune condition with very simple management. Okay, so this is a test to show you that tyrosine means thyroid. Okay, thyroid and toxic metals, it can block. Okay, what do toxic metals do? Toxic metals will deplete glutathione because it tends to detox and it damages the antioxidant system. So it generates reactive oxygen species and it wrecks lipids, proteins, and DNA. In the lipids, it causes lipid peroxidase. It can be tested in a urine test with a simple test available in the market. It damages membrane, protein oxidation, and protein dysfunction. DNA, it damages not only mutation, it also damages the base. It also damages the it also trigger carcinogenesis. Okay, heavy metals. So adrenal, you can see adrenal where it damages pituitary, thyroid, pancreas. So that is the reason that if you do 100 patients test, all the 100 patients will have toxic metal, but some of them will have developed diseases, and that is where the trigger occurs. Okay, I want to share something to you. Okay, for example, I draw for you a simple picture. Okay, so this is a lymph node. So when it's triggered, it will form TNF alpha. Okay, TNF alpha. So what drugs will do, like drug like Humira, it targets TNF. What I do, this is the damage done by the this is the damage done by the primary. What is the primary? The primary can be toxic metals. So what I do is I target the primary and the damage done by the primary. That means the root cause and the damage done by the root cause. This is the root cause. I target this. For that reason, this is targeted by RK restore, and this is targeted by RK 0. And we have reversed many diseases based on that. But if you look at some of the teachings going on around Malaysia, so-called gurus, what they will do is they will do extensive. Hold on. Huh? They will do extensive immunology to show how TNF gone into the cells and into the tissue to T cells and the B cells. All this immunology means nothing. All you have to look is at the root cause. You target the root cause. The moment you remove, all this disappears. Instead of giving XYZ product, this is XYZ product, this XYZ product, this is what our doctors are doing. It doesn't make any logic. All you have to do is get rid of this reverses the whole thing. Somewhere along the line, some of our doctors got mesmerized by some of these gurus. Okay, I'm not angry of it. I'm angry of some of the doctors because their understanding of physiology is so bad. Please, we are taxing on the patient so much that patients come down with hope. Behind the patient is a family waiting there. And what we are doing is we are causing more damage by not understanding a root cause. If we can understand a root cause, we can reverse any diseases. Okay, for that reason, my brain is worth a few billions compared to any doctor. Not that I'm challenging you, I'm challenging you that you and I are very intelligent, but somewhere along the line, our intelligence is lost by so-called gurus. Okay, I suggest that you and I read back many research articles. These research articles are not published overnight. They've taken time and effort. So I'm going to post back the research article or the studies I'm posting in International Medical University for my molecular medicine. I'll show you the article I'm posting in them. I'm doing along with Prof. Amara in University Kebangsaan, Malaysia. Okay, please don't come and tell me this mechanism. For me, very simple. Just remove the root cause, everything will disappear. Okay, we are going to do this correction, that correction. Go straight. One target, one root cause, take it out. Everything reverses. So what I'm showing is understanding. In thyroid, what is the 1 or 2 root causes? My way of doing management is very simple. If I have to rob Dr. Edwin's house, I will go front door and back door same time. I know he's got a bulldog. So bulldog cannot be in both the sides, either front door or back door. So I enter back door and front door same time. So I have 2 sets of management, root cause and the damage done by the root cause. Done. How is it that I can teach that so many doctors and we reverse the worldwide? Okay. Tomorrow, RK0 is going to be listed in Dow Jones. For that reason, I'm saying that RK0 has beaten everybody on earth, 8 billion people and every scientist. For that reason, I'm proud that I'm a Malaysian, I'm a regular doctor like you and me. We have the intelligence. Somewhere along the line, many of the gurus have diverted the path. I'm not angry of them, but you and I are so intelligent. Where is our intelligence lost to? So it's all about 3-dimensional picture. So thyroid, main function, look at the what is interfering with the thyroid and what is the other factors involved in the thyroid function. Clean up the gut, clean up the liver, give your bioidentical hormones. Patient gets corrected. Okay, not everything has to be that particular guru. No such thing as that. Okay. So I share you a little bit more and I may call it a day. Okay, thyroxine. Can you see toxic metals? Okay, gluten and thyroid have molecular mimicry. So if you see ray, can you see on the ray here? This is toxic metals. Okay, this is gluten. So gluten, if you're correcting thyroid, please check on the gluten whether the person has got the test done. Astride will show you barley, ray, and everything else. So these 3 things have molecular mimicry. I'll post a video in the group. Okay, case study. Okay, I mean leave the case study. Vitamin A is also related, but it's a minor factor. Okay, minor factor B12, B2, B3, B6, B6, D3 management. Okay, chemicals is another problem with thyroid. It blocks. Can you see this? Pesticides in the liver blocks. In the blood, you can see the conversion of T4 to T3 sunscreen. Okay, all the plastics, they bind with the protein transport. Okay, can you see very carefully T4? Okay, where it blocks the thyroid part. Okay, we need to clear all this. You have to look at very carefully about this. Don't get scared about it. If you go step by step, thalamus to TRH to thyroid, thyroid to TSH, say T3, T4, and what can block. Can you see? Okay, thiocyanates. Okay, you go step by step. You can definitely find. Okay, and PCB can block. Okay, all the beauty products, mercury, okay, hair dye. Okay, we need to look at all these factors. Multiple chemicals blockage, chemicals in pregnancy. Okay, can see chemicals. Radiation is another problem. Okay, radiation can come from anywhere. It can come from nature. Okay, and it can block. And one of the radiation is uranium. Uranium to break down, these are breakdown products. But the last stable product will be taurine. Uranium to break down radium, radon, and last breakdown lead. So lead can go and block the thyroid. Okay, management, NS-16 simplest, gut, last time was gut restore, it is now RK restore because doctors have been misguided by the public. Okay, you can give probiotics, clean up. Vitamin C can be given, minor indicator, major indicator. So can you see lithium? Lithium can block. Either excessive or below, both can block the thyroid active uptake. Okay, this is one of the tests by using oligoscan. Can you see a lithium deficiency went through the roof? Okay, this is frightening. Okay, lithium is related to thyroid too. Okay, so now you can go back. Selenium deficiency, potassium deficiency, lithium, iodine is all related to thyroid ahead of your blood test. What we do blood test doesn't do justice to the patient unless you do a hormonal saliva test for hormones and other factors. That's when you'll be able to see. Potassium is related to thyroid. Iron is related to thyroid. There's so many factors. Okay. Okay, leave all that. Okay. Simple test. Can you see Lugol's iodine on the hand? After 30 minutes, it disappeared. That means this person is hypothyroid. Okay. Okay. Leave all this. Come back, come back, come back, come back. Okay. So the last part I want to share with you today, I'm supposed to finish essential fatty acids, but it's already 11:30. Doesn't matter. What I want to explain to all our doctors is intelligence. What's intelligence? When I look at a patient, these are some of the questions I ask myself. What is the major framework? Let's say I come with tremors, like I posted today. Tremors, where is the tremors coming from? The tremors is coming from the brain. So when you divide the diseases, the main framework, it is coming from the brain. This is the main framework. This is a minor framework. So it can be involving this is the brain, major framework, minor framework. So as the patient showing me is having tremors, where you think the tremors are coming from? If it's unilateral or bilateral. If it's bilateral, where you think? It's a control from the brain. So we have to look at the brain. This is the major in the brain. What part of the brain is involved? The minor framework may be vitamin C deficiency, selenium deficiency because of mercury toxicity, okay, glutathione deficiency. These are minor frameworks. So if you go and follow some guru, oh, vitamin C is a major. Hello, how to go and remove mercury from the brain? How to cross the blood-brain barrier? So major framework. The second step I always like to ask is whether you're symptomatic or not symptomatic. If symptomatic, I want to know whether it's mild, moderate, or severe. Once I know this is a friend, then the next question I want to ask is it important or urgent? If it's important, then I can take my time to slowly overcome this problem. If it's urgent, it's aggressive, that is when you need to call for help from me. Okay. Otherwise, doctor, how much the dosage on the phone? No, that's not how it works. When you're looking at the patient, where is the problem? Okay. For example, okay, a patient comes with headache, and the patient is on Sendomigraine, or the patient is on Ponstan, or for 6 months to 1 year, it's not resolving. They send the patient to me. So I ask him very simple. I ask history like, okay, when is the time of a headache? Morning or night? Is it constant? Is it throbbing? Do you vomit out? Do you have fainting spells? How long does it last? So as the person is questioning him, I will already know already this person X-ray also none, CT scan also none, OMV also nothing there, and the patient has been diagnosed migraine and is endorsed as a migraine and is what do you call till death he's endorsed as a migraine. So he classified. He said I got constant migraine. All you have to do is when you do S-drive, you find molds and spores. It could be sinusitis. As simple, okay? And it could be riboflavin deficiency. So we have to key that. So his next question is it mild, moderate, or severe? Okay, then we have to ask what are the other problems associated with the headache? Is it a neck pain? Is it a spasm? Is it stress? Is it some form of brain tumor? So same thing goes down like frozen shoulder, which I'm going to conduct in another 2 weeks time. A patient comes with frozen shoulder on the right side. So how do you look at where is the major framework? Is the shoulder. So you ask history of trauma, whether it's whether it's a acroclavicular joint, or whether it's a muscular tear, or whether you had a fall, whether you had a fracture. That is as far as a local is concerned. Second step, ask yourself, is it a magnesium deficiency? Is it a D3 deficiency? Is it a calcium deficiency? Next question you want to ask, is it an autoimmune condition? Next question you ask whether it's coming from the neck, any impingement of the neck. Next question you want to ask whether it's a thyroid problem. Next question you want to ask whether it's an autoimmune condition, whether the patient got toxic metals and it triggered autoimmune. That's why the pain is here. And also ask for other pains, other joint pains. The next question you want to ask whether the person have GERDs, which may be reflecting on the shoulder. Next question you ask whether he has gallbladder problem on the shoulder. The next thing you ask whether a heart problem, maybe on the left side. So you need to clear it up. So you're very clear of your diagnosis even before you do a test. How can you and I find a diagnosis, the MRI on a brain oxidative stress? It's impossible. So that is why we use our intelligence and go back. And S-Tribe teaches us intelligence. So when I was in Italy with 300 doctors sitting there, is it S-Tribe is just a tool, but it challenges the intelligence of a doctor. So whether it's an allopathy or whether it's a functional medicine, it tests your knowledge. So if you and I go to one guru who's not well versed with others, they will not address the factor. Oh, only chelation is the solution. Half-life of lead is 24 years. It goes into the bone. It disturbs the osteoblast and osteoclast. It will become part of the bone by joining hydroxyperoxate. So how can it come out from the bone? Would chelation go and remove the bone? No, it chelates out more minerals. So that is why very important, where is a major problem? And in that major problem, what is the root cause? Are you symptomatic, or you looked at the blood test and said your cholesterol high, you're going to die? It is whether you have to ask whether it's symptomatic or asymptomatic. Next thing is you have to ask, is it mild, moderate, or severe? Then next question is it urgent or important? Then you can plan out the management step by step. So every time I ask a question in the WhatsApp group, how would you address step by step? Everybody freezes because we are taught symptoms, how to manage cases. Symptoms. So that's why I asked Dr. Jeevan, how would you relate to your medical practice, the article you read? I asked Dr. Haja, how would you relate it to the medical practice that you read? So you have to relate like that, relate until to a point, the moment you open some mouth, you can tell the diagnosis. That's the reason I asked Dr. Raymond also same thing. By the time he told me the history, I tell these are diagnoses. These are findings. So it's very interesting. Okay. So I want to thank every one of you for staying so long with me, 1.5 hours. And we had a very interesting session. I believe these 40-year-old doctors are beyond most of the other doctors in Malaysia because you have a very balanced thinking. Please register with your internet marketing because I'm going to take you global. Because the person I'm discussing with has already taken the global position into many, many countries. They're looking forward for our doctors to educate the rest of the world. It's a honor and a privilege to present our doctors to the global level. Okay, and I seriously believe that most of you are very, very good, but you didn't see it that way. I can help you all the way, no problem. Okay, I want to thank you, every one of you, to stay with me. And a very special thanks to Dr. Jeevan and Dr. Haja to come forward. Next session will be Dr. Selvam, who's a physician diabetologist, will be presenting on branched-chain amino acids and insulin resistance. He's a diabetologist. And Dr. Unati will be presenting on selenium and cancer. Right? We will meet up again next Friday, 9:30. Please don't be late. And I want to thank you so much. Right? Good night. Thank you so much.
Thank you, Dr. Alan.